The CDC changes guidance on COVID isolation. They are no longer recommending people isolate for 5 days. Instead, people who test positive can return to work or school if they don't feel sick or they don't have a fever for at least 24 hours. And of course, it's COVID, so it's causing confusion. Joining us to talk about this and our other health headlines, Dr. Jeff Pothof, UW Health's Chief Quality Officer. Doctor, great to see you. All right. So let's just say I'm sick, I test positive for COVID. Now, what should I do?
Well, there's a few things. First, you ask yourself, do I work in a healthcare system or in healthcare? And if so, the old rules apply. You isolate for a period of time, at least 5 days. But if that doesn't apply to you, what you're looking for is cessation of some of your major symptoms, so muscle aches and pains, sore throat, headache, things like that. You may still have a lingering cough, and you need to be fever-free for 24 hours. And you can't take Tylenol and ibuprofen to do that. That's called cheating. So without medications, fever-free for 24 hours, then you can go back to work, you can go back to school. It doesn't mean these people are not infectious. There's some of those will be infectious, but we're not seeing as higher rates of severe disease, hospitals overwhelmed with COVID. So the CDC is trying to make this simpler and kind of take this back to what we recommend for other respiratory diseases like flu, RSV, common cold.
Yeah, they're trying to simplify this. That's why the big change here. There's so many work policies, you know. If you used to get COVID, you had to stay out for 5 days. So that shouldn't be the case anymore?
No, I mean, I think that's one of the things folks are worried about is it could result in employers having folks come back, you know, maybe a little bit early. There is a little bit of gray around what does it mean to feel better. The objective criteria is more around the fever, but I do think it does simplify things for both employees and for employers on what does it mean to have a, respiratory illness and when can I come back to work after I've had that.
Hey, speaking of COVID, there's this fascinating new study out that says there may have been some benefits from the pandemic for babies that were born during those lockdowns. What does this study say?
Yeah, so, whoever said researchers weren't creative didn't meet this group of research teams, because what they decided to look at is that during the pandemic, we would look at babies and their gut microbiome, so kind of like the natural flora in their gut, and did the pandemic have any effect on it? Lo and behold, it did. So they saw basically better gut health in these babies during the pandemic, and they don't know exactly why, but what they're attributing it to is they weren't getting as sick as often. They were protected. They were in their homes. They didn't see antibiotics. We know that can have an impact on the gut biome. And then likewise, they were breastfed for a longer period of time during the pandemic, probably because their mothers didn't have to go back to work so quickly, and that seemed to be beneficial. So, leave it up to science, but it looks like a pandemic can be better for babies' guts.
It's so fascinating. I mean, me and my wife, we had a baby in 2020, and it kind of makes sense because we joke sometimes because she was pregnant, nobody saw her. It was like they saw her, and then the next time they saw her, she was carrying around a baby. So my wife wasn't really getting sick that often because we weren't coming into contact. So that maybe is why we've got the benefits here.
Yeah. I mean, I guess there's a silver lining in everything.
Yeah. Okay, let's talk quickly about this yogurt label. Because get ready for some new labels on your yogurt. Eating it could lower your risk of type 2 diabetes if you listen to the companies. The one problem, doctor, that may not be the case.
Yeah, so there's this process where companies can solicit the Food and Drug Administration to allow them to advertise using specific language. And this is Dannon, who makes a lot of different yogurt products, saying, hey, there's studies that suggest that, eating yogurt 2 cups or more per day can reduce your risk of developing diabetes. And there's studies that are in line with that. I think where folks think it's a little bit tongue-in-cheek is yogurt is not yogurt, right? I mean, there's yogurt that's loaded with sugar. We would never recommend that for folks that wanted to prevent diabetes. And then likewise, what they're not saying is that if you have diabetes and you just eat a lot of yogurt, you'll be cured. They're not trying to make that claim either. It's not a medication. It doesn't fix diabetes. It's not a bad thing to eat, but there's maybe not as much benefit to eating yogurt as maybe the company would want you to believe.
Okay, good to know that I shouldn't just taking spoonfuls of yogurt and shoving it down my face and thinking it'll be the cure-all. All right, doctor, appreciate it. Thanks for joining us.
Thank you.